Hi, I am ESkehan, and I'm here to talk to you about hepatitis C trends in incidence and prevalence and populations at risk. A non-empirical research method was applied to review the current literature regarding the public health issue hepatitis C virus. Hepatitis C is a virulent form for which there is no vaccine available. Conservative estimates of the prevalence are that over 1% of the population in the U.S. is living with hepatitis C disease. As recently as 2009, the cohort with the highest rates were the baby boomers. The paradigm has shifted, and multiple generations are experiencing high rates of infection. Data from 2018 revealed that millennials account for 36.5%, baby boomers account for 36.3%, and Generation Xers account for 23.1% of new cases. Over two-thirds are male. Currently, it is estimated that 2.4 million people are living with hepatitis C in the U.S. alone. Some epidemiologists predict the number may be as high as 4.7 million or as low as 2.5 million. More than half, 51%, of those living with HCV are unaware. They are not only at risk for severe liver disease, but may be transmitting the virus to others unknowingly. Early recognition, early diagnosis, early treatment, and prevention are the keys to improving outcomes, preventing further spread, and providing patient-specific education to eradicate this disease. Nursing will be instrumental in providing HCV screening, counseling, education, and interventions. Viral hepatitis is caused by different types of virions specific to the liver. The most common types are hepatitis A, hepatitis B, and hepatitis C. The hepatitis C virus is carried primarily in the blood. The HCV can cause acute and chronic hepatitis with varying degrees in severity. Routes of transmission are direct exposure to contaminated intravenous equipment such as needles and syringes and sexual intercourse due to an exposure to the infected person's blood. Other transmission modes include unscreened blood or blood product transfusions, organ transplants, and transplacentally, that is, an infected mother transmitting the virus to her unborn child. HCV is the leading cause of morbidity and mortality from liver disease in the U.S. Acute hepatitis is often asymptomatic, and its diagnosis sometimes delayed for decades. More alarming is that greater than 50% of these cases will progress to a chronic infection, which, if left undiagnosed, untreated, can eventually lead to death. Most HCV-infected patients do not present with symptoms until they have advanced liver disease. In a recent report, only 61% of adults in the U.S. infected with hepatitis C were aware that they were infected. Until recently, the birth cohort with the highest prevalence rates was the baby boomers. The tide has turned. The birth cohort with the largest numbers is the millennials. This pie chart depicts the distribution of the hepatitis C cases according to their social generations. The methodology utilized for this epidemiology project was a non-empirical examination of the available literature regarding the public health issue of hepatitis C disease. The prevalence and incidence, risk factors, prevention and treatment strategies at a national level were explored. The proposed research question is, what strategies and nursing interventions will reverse the trends of hepatitis C virus and decrease the prevalence and incidence for those populations most at risk? The hepatitis C virus is bloodborne. In the United States, the annual rate of reported cases of acute hepatitis C was 0.3 for every 100,000. In 2009, an increased threefold to 1.2 by 2018 for all age groups. In 2018, the CDC estimated that almost 2.4 million people in the U.S. were living with hepatitis C. Before 2009, the age group with the highest incidence was the baby boomer generation, those born between 1946 and 1965. By 2018, persons most affected were persons aged 20 to 29 with 3.1 per 100,000, and persons 30 to 39-year-olds with the incidence rate was 2.6. Hepatitis C poses a serious health threat. Those born between 1945 and 1965 account for about 1/3 of the chronic cases, but have the highest death rate. Adults under 40 account for the highest rate of new infections, mainly due to the opioid crisis. Other risk factors include high-risk sexual behaviors, infants of HCV-infected mothers, and they have a 4 to 7% increased risk of acquiring the virus transplacental. Between 2001 and 2014, analysis of national lab data indicated an increase of infants born to HCV-infected women rose 68%. In Table 1 to the left, males comprise 63.1% with chronic HCV compared to 36.9% females. The 30 to 39-year-old group accounts for 23.4% of the new cases. The millennials, born between 1981 and 1996, accounted for 36.5% incidence of new cases in 2018. The graph below, Table 1, depicts the distribution related to birth cohort and the three most affected. The last chart in the column depicts the distribution of males in light blue and females in dark blue, and the pie chart is to the far left is an illustration of the visual of the social generations. Primary prevention for hepatitis C. Although there are vaccines for hepatitis A and hepatitis B, there is no vaccine for HCV currently available. Prevention is dependent on reducing risk of exposure to the hepatitis C virus. The following interventions are recommended by WHO: safe and appropriate use of healthcare injections, safe handling of disposables of sharps, provide harm reduction services for IV drug users such as Clean Needle for free, test donated blood for hepatitis B virus, hepatitis C virus, HIV, and syphilis, educate healthcare personnel on prevention, and prevent exposure to blood during sexual encounters. Secondary prevention includes education and counseling for care and treatment options, immunize with hepatitis A vaccine and hepatitis B vaccines to prevent co-infection, and early and appropriate medical management regarding antiviral therapies and regular assessments for early diagnosis of cirrhosis or cancer. Tertiary prevention includes psychosocial counseling, modifiable factors such as alcohol use, obesity, insulin resistance, and marijuana use. Counsel against any alcohol use as there's already liver disease in progress. Also counsel regarding preventing transmission to others. Below is a picture of the United States and the rates of reported acute hepatitis by state in 2018. Efforts should be focused on screening those at high risk, people with HIV, current or former injection drug users, including those who injected once or many years ago, patients who received hemodialysis, people who received organ transplants or transfusions of blood clotting factor prior to 1987, people who received a blood or blood components transfusion prior to July 1992, people whose alcohol intake is moderate to high, healthcare workers after needle stick, sharps, or mucosal exposure to HCV-infected blood, children born to HCV-positive mothers, and pregnant women, except in areas where prevalence is less than 0.1%. Most at risk for cirrhosis are males over age 50, consumes alcohol, have comorbidities such as non-alcoholic fatty liver disease, hepatitis B or HIV, or are receiving immunosuppressive therapies. Treatment includes antiviral therapy specific to the HCV genotype as recommended by the Infectious Diseases Society of America, American Association for the Study of Liver Diseases, and International Antiviral Society, USA. In conclusion, hepatitis C is often unnoticed until liver damage has already occurred. 10 to 20% of those infected with HCV will develop cirrhosis within 30 years, and 1 to 5% of those will be at increased risk for liver cancer. Chronic HCV is the leading cause of liver-related death and liver cancer in the U.S. There is no vaccine for HCV yet. The focus should be identifying and treating the populations most at risk. Antiviral drug therapies developed since 2011 are highly efficacious. Researchers developed drug therapy specific for the HCV genotype with the added benefit of fewer side effects, shorter treatment durations, and higher cure rates. Treatment and cure is not possible without identifying and screening those at risk, early diagnosis, and treatment. The most important strategy is through prevention efforts. Nurses are in a unique position to screen patients, leading to prevention, early diagnosis in the presence of disease, and early initiation of treatment to decrease the risk for morbidity and mortality. These simple measures can create opportunities to improve outcomes for these patients as well as future generations. Nurses will play a pivotal role as leaders in the fight to reversing trends of HCV through education, as care coordinators, and as primary health care providers. One plausible solution is to screen every patient every time for risk factors, behaviors, provide appropriate referrals, and counsel patients regarding the benefits of modifying behaviors to reduce risks. And these are my references.